Kanjai and not Japheth Kome. We do apologize for that small mistake. All right, now moving on to some other developing stories. And the Kenya Union of Clinical Officers has threatened to commence their planned nationwide strike on the 19th of January 2025 if the government fails to address their issues. While speaking in Nairobi, the clinical officers say the Ministry of Health has delayed in looking into the increment of their monthly salaries. Elizabeth Ateno with the details.
In the next 48 hours, Kenyans seeking care for critical services like chronic conditions, administration of vaccines, diagnostic tests, mental illness treatment, among others, will be dealt a blow following a planned nationwide clinical officers strike set to kick off.
We issued this current strike notice for 14 days with the similar issues where the government has violated the laws and orders.
The clinicians want more than 1,100 hospitals under the cadre to be empaneled into the Social Health Authority. According to KUCO, the Social Health Insurance Act mandates the Social Health Authority to recognize all the regulatory bodies, including the Clinical Officers Council, but the authority has only recognized the Kenya Medical Practitioners and Dentist Council, KMPDC, a move they say is a sinister plan aimed at extorting facilities not registered by KMPDC.
That is why we are telling the president that the biggest obstacle, the biggest threat to universal health coverage is the Social Health Authority team that he has put there together with the extension of the cartel in the ministry and in the Kenya Medical Practitioners Council.
Look at the Social Health Authority program. Patients are not able to get outpatient services from a level 5 hospital with this insurance cover. And therefore, the private hospitals end up now offering these services to our patients.
The clinicians further say they have been coerced into paying for medical officers' license for them to be pre-authorized, a move they have strongly condemned, saying it depicts corruption and impunity.
Maafisa tabibu ambao ndio wengi wamekatazwa pia kuona wagonjwa na wanaambiwa watumie namba ya mtu mwingine ama sajili ya mtu mwingine kuwaona wagonjwa.
On Wednesday this week, Health CS Dr. Deborah Barasa cited the Quality of Care Bill as a critical advancement in addressing crucial facets such as infrastructural improvements, optimizing health products and technologies, strengthening health systems, and fortifying human resources for health. KUCO, however, maintains there is no legal lacuna. Hence, the bill is not necessary.
And one of the areas we're looking into is having the quality of care bill that will be able to be tabled and ultimately will be able to have improved coverage.
They are telling that they want a quality of care bill to establish a quality of care board for the accreditation of the facilities. They are trying to lie to the president, to parliament, and to others that there is a gap in law. There is no gap in law.
Other issues that the clinical officers want addressed include discrimination, underfunding, poor working environment, arbitrary transfers, withheld salaries, and unpaid health risk allowance. Elizabeth Atieno, TV 47, Nairobi.